Department of Health and Community Services, and I'm the moderator for today's question and answer session. Joining us today are the Honorable Andrew Furey, Premier of Newfoundland and Labrador, the Honorable John Haggie, Minister of Health and Community Services, who is joining us via Skype from Gander, and Dr. Janice Fitzgerald, Chief Medical Officer of Health. Please stand by. Our news conference will begin shortly.
Ready, Dr. Fitzgerald? Yeah. Okay. Good afternoon, everyone, and thank you for joining us for the Government of Newfoundland and Labrador's COVID-19 update for today, March the 5th. I'll now turn things over to Dr. Fitzgerald for a quick update.
Thank you, Premier. Good afternoon, everyone. Thanks for joining us today. Since the media advisory yesterday, we have one new confirmed case of COVID-19 in our province. This is in the Eastern Health Region, and the individual is between 40 and 49 and a contact of a previous case. The total number of cases in our province is now at 1,003. There have been 9 new recoveries in Eastern Health, leaving 113 active cases in our province. 7 people are in hospital due to COVID-19, and a total of 114,211 people have been tested to date. The continued low case counts we have seen this week are very encouraging, particularly given that they are the result of travel or contacts of other confirmed cases. While we remain optimistic, it is important for us to have confidence that the risk of community spread is reduced so that we can begin easing of restrictions both on and off the Avalon. To help us in this regard, Eastern Health will be offering voluntary testing to individuals who are not experiencing COVID-19 symptoms. We know that many individuals who test positive during this outbreak had no symptoms at all. So this surveillance will help us determine if there are any pockets of COVID-19 that have gone undetected. It will also help us in our decision to ease restrictions further. Testing centres in Mount Pearl, St. John's, Burin, Harbour Grace, and Clarenville are now accepting appointments for asymptomatic individuals who wish to receive a COVID-19 test. Additional mobile testing clinics will take place in Trepassey, Bonavista, Placentia, and downtown St. John's throughout the next week. If you wish to book an appointment, please complete the online assessment tool or by calling 811. When completing the online self-assessment tool for asymptomatic testing, please select both of the following options to receive an appointment. Select I do not have symptoms, and select yes for the question, do you require COVID-19 test as a result of an advisory from public health? While I know that people take comfort in low case counts, I caution everyone not to let your guard down. We are simply not there yet. Everyone must continue to adhere to public health restrictions and recommendations according to your region of the province. Today, we have more good news on the vaccine front. We are announcing the first recipients of the AstraZeneca vaccine. The initial shipment will be offered to first responders and frontline essential workers. These individuals are critical to the protection of lives and safety in our communities, as well as essential to the societal functioning that has to persist regardless of the prevalence of COVID. AstraZeneca vaccine has been approved for those under 65 years of age, which aligns well with the demographics of these priority groups. We expect that vaccinations will begin as soon as the first shipment arrives here. As well, Health Canada has approved another COVID-19 vaccine, this one manufactured by Janssen Incorporated. This adds another safe and effective option for provinces and territories. This is a one-dose vaccine approved for individuals over the age of 18 and can be stored at temperatures between 2 and 8 degrees Celsius, which makes it easier for transportation. As the announcement was only made this morning by Health Canada, we do not yet have confirmation of the amounts or timelines for shipments of this vaccine for Newfoundland and Labrador. I am also pleased to report that we have almost 60,000 individuals pre-registered for a COVID vaccine in the 70 and older age group. This is a substantial proportion of that age category, nearly 80%, and I'm very encouraged to see so many people making the choice to be vaccinated. As I've said before, everyone in our province who can be vaccinated should be vaccinated. More people vaccinated means greater community protection against COVID-19. Better protection means hopefully a faster return to our normal lives in a fully functioning society. Starting today, both Western Health and Central Health will begin contacting those over the age of 85 who have pre-registered to book their appointment for vaccination. Please be patient. It might take a couple of weeks for your RHA to get to your community, but if you've pre-registered, you are in the queue. I would like to thank today the Newfoundland and Labrador Centre for Health Information. They are responsible for supporting our surveillance and reporting systems and have created new technology platforms such as the travel form, the COVID online assessment and referral tool, and our new vaccination registration system. While the staff of the centre are behind the scenes, they have played a critical role in helping us to respond quickly to this rapidly changing pandemic. As a recap, for those who may have just joined us, we have one new confirmed case since yesterday's media advisory, and the total number of cases in the province is now 1,003. Although we are making great strides, our work is far from over. Every decision we make is carefully considered, based on risk assessment, and closely monitored. Our provincial public health system has done its very best to protect our population and will continue to do so moving forward. Our ability to control this outbreak has only been possible because of the trust you have placed in us. We ask for your continued patience and commitment in the months ahead as we continue to navigate life with COVID-19. So hold fast, Newfoundland and Labrador, and thank you.
Well, thank you, Dr. Fitzgerald. This has been our third week of lockdown on the Avalon, and in the last few days, we've seen our numbers move down to single digits and our recoveries move way up. Please keep in mind that we're not out of the woods just yet. You have to keep your guard up. The COVID variant has put us all where we are today, but our collective will and efforts is getting us right back out. People are following the health measures, and the numbers reflect that. Be optimistic. It's good for your mental and physical health. Month by month, as we move towards summer, things will get better. They are getting better. The federal government today announced the approval of Johnson & Johnson's single-dose vaccine. More vaccines mean more hope. We will have 80,000 people vaccinated by the end of the month. And our hope and our plan is that by the end of June, every Newfoundlander and Labradorian who wants to be vaccinated will be. It's important to know that as more and more people get vaccinated, they still need to abide by the public health measures and respect social distancing till further instructed. But again, this is a good news day, and everyone in our province should feel a little bit better about the brighter months to come, Before we get there, we all need to dig a little deeper and continue to follow those public health measures. Listen to the advice of Dr. Fitzgerald and her team. Be vigilant with our health measures. Be patient. And most importantly, be kind. It promises to be a great summer in Newfoundland and Labrador. Let's all keep working collectively towards that. I'll now turn it over to Minister Haggie for a brief update.
Thank you very much, Premier. Again, 113 active cases on day 362 of these media briefings. We have AstraZeneca and doses inbound, hopefully within the next week. And now Janssen have been approved to a single-dose vaccine of the same type as AstraZeneca, but approved for anybody over the age of 18. The registration for vaccines for over 70s continues with the last group of the alphabet starting today. When that finishes on Sunday, those slots will open for anybody who may have missed their opportunity when their name came up. I would encourage everyone to continue to do this online if possible, and for those who can't for various reasons, there is the phone line. We still, even for those people who are vaccinated, do not know what effect, if any, a vaccine will have on people's ability to transmit the virus one to another. So the importance, as Dr. Fitzgerald said, is to hold on and continue to follow current public health guidance. In terms of the other initiative announced around pop-up surveillance, this will be a combination of the existing clinics in places like the Reid Centre, but also some mobile clinics. And I just repeat what Dr. Fitzgerald said. The best way to deal with this is 811healthline.ca and fill in the self-assessment form, filling in both, yes, I have no symptoms, and yes, this is the result of an advisory, and then you will be offered an appointment at one of the fixed or mobile clinics. I think this is a tribute, the position we find ourselves in, to public health and Newfoundlanders and Labradorians, and something of an example, I think, to other jurisdictions in Canada and around the world. We need to hold the line, and if we do so, then I think there is a very real prospect of a new summer for all of us. So with that, Premier, I'll hand it back to yourself.
Thank you, Minister Haggie. I'll now open it up to the media for questions.
Thank you, Premier. For the benefit of our speakers, there are 7 reporters registered for today's call. The question and answer session will be conducted in 2 rounds, where each reporter will have the opportunity to ask 1 question and 1 follow-up per round. Following this, I will ask each reporter if they have 1 final question. Our first questions are from Peter Cowan with CBC. Please go ahead.
Minister Haggie, I'm wondering if you could expand on that comment you just made that we're on track for a new summer. What do you think our summer will look like?
Again, optimism, I think, is the order of today. I certainly recall last summer, and the staycation season started late. I think we may well be on track to start on time this year. I think it's too early to say what will happen in terms of interprovincial travel, because that's outside our control. But I really think that by the end of summer, there will be some serious consideration maybe of going back to alert level 1, which we've never been to yet. But again, this is all speculative. We need to check on our surveillance, and we need to have this trend, very optimistic as it is, maintained and roll out our vaccines. And the only thing that's holding us back with vaccine is vaccine supply.
And with the announcement that the AstraZeneca vaccine is going to go to frontline essential workers, including police and paramedics, I'm wondering, with 7,000 doses arriving in the next week or so, who are the essential workers? Because there's a lot of confusion, for example, people working in grocery stores wondering, there isn't a list out. Am I going to be included as a frontline essential worker for these vaccines?
Yes, so certainly, we've been reaching out to some of our first responders right now, and certainly we know the number of first responders that we have in the province is very similar to the number of vaccines that we're actually getting. So, our first reach out will be there, and then as we move through and as we get more AstraZeneca, then we'll be offering it to those who essentially have to go to work. The people who had to go to work through Alert Level 5 and be in contact with the public. So these are the groups we'll be targeting going forward.
Our next questions are from Richard Duggan with BOCM. Please go ahead.
Thank you. Dr. Fitzgerald, with this announcement today that we're going to begin voluntary testing of asymptomatic people, I was wondering if you could expand on the group that we're targeting here, because, of course, asymptomatic people will cover a lot of ground. Are there any specific pockets of people you wish to target with this? So, for example, maybe asymptomatic people who are on the front lines. Is there any specific target group here?
No, what we're trying to do right now is to get a snapshot for the population to see where, if anywhere, that COVID is. So I would suggest to anybody, if you want to get tested, to certainly reach out. Eastern Health will be providing some of that information in a news release as well, so you can certainly check on their website and to reach out and get tested so we can see it doesn't mean if you don't have symptoms. Obviously, if you have symptoms, you still do our online assessment and referral tool and get your test done. But we haven't routinely had it open for people without symptoms. So this is just something new for us, just to get an idea of what's out there. So I would encourage anybody to come forward and get the testing done if they have concerns. If you're on the front lines, yes, absolutely. Please reach out, and fill out the form to get an appointment. And this will be going on over the week, the weekend and next week. So there'll be time to get in there.
Thank you. And in terms of the AstraZeneca, the Johnson & Johnson vaccine that was announced to be approved, this vaccine is different in that it's a single-dose shot. Can you explain exactly what that means and how it's different from the other products that are out there, like Moderna and Pfizer?
So the Moderna and Pfizer are what we call mRNA vaccines. The Janssen and AstraZeneca are both viral vector vaccines. Janssen has done its study with a one-dose regimen for its vaccine, and it found it to be quite effective. So that's why it's recommending a one-dose regimen for the vaccine.
Thank you.
Our next questions are from Roger Bill with the Shoreline News. Please go ahead.
People who are registering for vaccination in phase 2, when will the first vaccination start to happen?
So for those over 70 who are registering, so the health authorities will be reaching out over the next week. Central Health and Western Health will be reaching out to book appointments starting next week for those over 85.
And the appointments will likely be when, Dr. Fitzgerald? That's what I was wondering.
Pardon me?
The appointments, when will they likely be? That's what I was wondering. Not when they're going to be booked.
Yeah, so my understanding is that the appointments will be for next week.
Oh, okay, I understand. Thank you. And how is the order decided? Who's first, second, and third? I would presume it's organized by geographical area and then ranked by age. And if that's the case, other people in phase 2 who aren't age-specific, where do they get slotted in after the last 70-plus people are vaccinated?
So certainly we know that the greatest risk is age. And as the older we are, the more at risk we are for severe disease, and we certainly see a fairly sharp gradient after 70. So that's why we're offering it to this age group. So what, certainly operationally, I wouldn't want to presume to be able to comment on exactly how things are rolling out in the region. They're certainly the experts in that area, but my understanding is that they'll be going into communities and they'll be offering the vaccine to those that are in the appropriate age group. Some communities, that are more isolated, that may take a little bit more to get to, and especially now that we've extended the dose interval, it may mean that they do more than just over 85. They may do over 75 in some of those communities because they're there, and it just makes more sense logistically to do as many people in that age group in the over 70 age group as they can while they're there, rather than to have to go back 2 or 3 times. So it'll depend very much on their context.
Our next questions are from Jason Piercy with Rogers Communications. Please go ahead.
Hi, hello. There seems to be some misunderstanding about how vaccines actually work when it comes to preventing the contraction of a virus versus lessening the severity of the symptoms of said virus. I'm wondering if you can clarify that for us such that people don't misunderstand what they should be expecting after vaccination reaches the majority of our population that decides to take advantage of it.
Yeah, so the way the vaccines work in general is that if you get exposed to, if you've been vaccinated and you get exposed to that virus, we'll say, for example, going forward, then your body will mount the immune response necessary to prevent that virus from taking hold and causing an infection. Doesn't mean that virus can't get into your system, and in fact, it kind of has to get into your system in order for your body to be able to respond to it. So, what it basically does is your body has been primed to be able to deal with that virus, so that once it sees it, it knows, oh, here's what I have to do. These are the antibodies that I need to be able to protect against it. So you never really develop the disease. So that's what we're talking about here when we're looking at severe disease. They're looking at how many people got really sick, ended up in hospital, ended up in ICU, or unfortunately may have died after receiving the vaccine. And that's what we're seeing protection against at this point. As we get more experience with this vaccine, we will likely be able to get information about how does this vaccine prevent spread from one person to another. So, if the measles vaccine, for example, you have 2 shots of that, it's highly effective vaccine. If you have the measles vaccine and you get exposed to measles, then chances are you're not going to pass it on to anyone else because you won't develop the disease. We know this is true for measles because we've had many, many years of experience with the measles vaccine. So we're just learning all of that with COVID right now. So that's why we can't answer those questions right away, and it wouldn't really be responsible of us to try to say that it reduces transmission when we just don't have the evidence. The expectation is that it will, just as many other vaccines have, but we need to have that evidence first.
So having that said, is it entirely possible that someone can be fully vaccinated and still contract and carry and possibly test positive, but just be much less likely to become severely ill?
Yeah, theoretically that is possible, and certainly we know, it takes a little bit of time for the body to respond to a vaccine to be able to produce those antibodies that are necessary. So the first 2 weeks after getting the mRNA vaccines, for example, there have been people who have still gotten infected with the virus in that period of time, and that's not unexpected. So yes, it is possible, and especially with the tests that we're using, they're very, very sensitive. It doesn't take a whole lot of genetic material to give you a positive test. So, theoretically, it's possible, yes. I don't know how probable it is, but it's possible.
Our next questions are from Andrew Robinson with The Telegram. Please go ahead.
Good afternoon. Regarding the Janssen Inc. or Johnson & Johnson vaccine announced today, I've seen it reported we're likely to get 10 million doses nationally by September. Based based on, I know you suggested it's too early to say exactly how many doses Newfoundland Labrador might get, but I mean, is there any sort of way to estimate based on what we've received so far of orders of other vaccines? You know, how much the province might expect in terms of a number or a percentage even?
I don't think we just don't have that information
No,
right
we
now.
really don't at this point. It's just so new. We haven't even had those discussions at all, really.
Good. My second question, following up on that, if this vaccine is a single dose one, and say we're at a point, towards the end of June where everyone has received the first dose of the vaccine, would the Janssen one as a single dose vaccine, would it still be able to serve the function as, being that second dose necessary for people who've received the first dose of a 2-dose vaccine?
So we don't really have a whole lot of information about the, mixing and matching vaccines at this point. There are some studies that are looking at that, but we don't really have any definitive information really about how that should happen, or if it can happen, or if it's beneficial for that to happen. It's difficult to know at this point. So I guess there really isn't an answer to that question. Our goal is to for 2-dose schedules is to complete the 2 doses with the same vaccine.
Thank you.
Our next questions are from Michael Tutton with the Canadian Press. Please go ahead.
Good afternoon. What does 1.5 million additional nationally Pfizer vaccines mean for Newfoundland and Labrador?
Sorry, I missed that, the
was
question.
The additional 1.5 million that the federal government announced of Pfizer, what that means, it's a per capita formula.
Yeah, it's a per capita formula, so it'll mean, I don't even know what the percentage is right now. Premier, I don't know if you know off the top of your head.
1.4%.
1.8% times 1.5 million. Yeah. Carry the one.
Right, but what is it that what does that mean? What is that for the province? How significant is that going to be?
I think that anytime we get more doses of vaccine, it's significant. It allows us to achieve the goal. So we want as much vaccine as we can possibly get, no different than any other jurisdiction in the province, in the country, sorry.
Okay, and my second question is Premier or the Minister of Health. What are your plans for treatment of people with long-term symptoms of COVID, sometimes called long haulers?
Well, that's more of a clinical question, I suppose, so probably 3 of us could answer that to some extent, but I think it's safe to say that, the system will be set up to provide whatever care that they need in the short, medium, and long term. I know that there has been reports, and we're still learning, of course, the long-term effects and impacts of COVID-19, but the department and our healthcare providers will be there to provide whatever supports patients' needs as they develop and as they emerge on their recovery path and rehabilitation from COVID-19.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. For those who are in a continuous state of self-isolation or those who return to the province to have self-isolate, can they still avail of this symptom-free testing?
Certainly if people are have returned and are so anyone who's self-isolating who would be a contact of a case, first of all, they would have had testing arranged for them, so I don't think that would be necessary. If it's people who are traveling back into the country and they really want to get testing done, then certainly they can reach out, and there are processes in place already for those people, because if they develop symptoms, there's processes in place for them to get tested. So yes, they can reach out.
Thank you. And now that we're opening up testing a bit more, is there any changes for rotational workers? Are we looking to go back to the previous system we had in place, allowing for testing on day 5 or 7, and then alleviating their self-isolation based on results?
So this testing right now is a short-term not really project,
Biopsy.
but yeah, we're doing this just to inform our decision making in the next week or so. So it's not something that we'll be doing, ongoing from this point onwards. I just want to make that clear. We are looking at the situation for rotational workers and how we need to approach that in this day and age of variants now, and seeing those rise in many countries around the world as well as in our own country. So we're looking at that and hoping to have some further information about that in the coming days.
Thank you.
Our next questions are from Peter Cowan with CBC. Please go ahead.
Question, why is Central and Western starting their vaccinations for people over 85 before other regions like Eastern?
I think some of it just has to do with numbers of people, but Eastern will be starting as well, to the best of my knowledge. I'm just, as of time that I came out here, I didn't have that information, but I believe they will be starting in the very near future as well with regard to calling people over the age of 85.
And my follow-up question is for Minister Haggie. With the cases that we're seeing dropping, why is the health system still cancelling routine medical procedures? Looking at other provinces like Ontario, they have continued even in lockdown to do many of those procedures, even with higher rates of COVID hospitalization and higher daily case numbers.
Yeah, good question, Peter. On the level 5, the planned procedures are off, and until we make a decision about that, I think that's a prudent risk management strategy. In terms of level 4, this is very much down to the discretion of each individual regional health authority, much more so. In terms of background activity or ongoing activity, maybe a better phrase, cancer-related surgeries that are deemed urgent, diagnostic tests that are deemed urgent or time-sensitive have never been halted. We never, for example, had to stop cancer chemotherapy or radiation treatment, such as Ontario has done in the past. So I think we're in a slightly different situation as to what will happen next. I think that really depends on the results of the pop-up surveillance, on whether we can move to level 3, for example, off the Avalon, and certainly that would free up a lot more capacity in the healthcare system to look at getting back onto the routine work of the healthcare system.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Thank you. A week ago, when the vaccination plan was announced, it was said that government was still working out the kinks to ensure that people aren't skipping the line, as it were, to get their vaccine earlier. Do we have an update on what's being done to ensure that that doesn't happen?
I think, Richard, you're referring to people like disclosing the honors, an honor system based on their own medical conditions and such? Is that what you're referring to?
Yeah, so people who, say, wouldn't be in one of the identified priority groups trying to register anyway and hopefully getting their vaccine earlier.
So right now, the pre-registration is open to those 70 and above, and that's certainly something that's quite easily checked with an MCP. So, I don't anticipate that there'll be many people jumping the queue in that situation.
Yeah, my question is more so about, do we have any more protocols, I guess, a more concrete vetting process in place yet as we move towards the vaccination?
So those are questions we're still looking at. Each group that we look at is quite different. Some of them are very difficult to capture, and trying to find ways to do that while still maintaining efficiency and ease of use of these registration systems is something that we're working through. So at this point, that's, I guess, what I can say is that we are working through them, and as we anticipate going to different groups, then we'll have some of those things in place. But some of the groups, we'll be just able to reach out to, and that will be, it'll be us going to them, and we won't need them to come in and register.
Okay, and Dr. Fitzgerald, yesterday, the town of Deer Lake announced the use of the arena section of the Hodder Memorial Recreation Complex as a vaccination site for Phase 2. Would you recommend other municipalities look at similar facilities, and what guidance do you give now as towns and cities are looking to navigate this process and prepare for the vaccination process?
So, I would imagine that any of these towns would be in discussions with their regional health authorities as to where vaccination clinics could be held. So I would say I'd leave that to them for that discussion to make sure that there's guidance in place. But the regional health authorities certainly would have that in hand.
Thank you.
Our next questions are from Roger Bill with the Shoreline News. Please go ahead.
I don't know if the question's for Premier Fury or Dr. Haggie, but I have a feeling like I'm missing something here. I'm trying to understand the math that gets us from 80,000 people being vaccinated at the end of this month, which I think is the number that Dr. Haggie used last Wednesday, to getting to the point where everybody who wants to be vaccinated is vaccinated by the end of June, which is Premier Fury's goal. So just bear with me. If we assume that the total number of people who want to be vaccinated is, let's say, 440,000, 80,000 are already vaccinated at the end of this month. That leaves 360,000. And then we have to vaccinate at the rate of 120,000 a month to meet the goal of having everybody done by the end of June. Yet we're getting 6,000 doses in round numbers of Pfizer vaccine every week. The Prime Minister said the number has gone from 6 million to 8 million this month nationally. That was just a few minutes ago in his remarks. So proportionally, that we use the same number. Our 6,000 goes to 8,000 every week. That's 32,000 a month. We don't know about Moderna. We don't know about AstraZeneca. J&J, Canadian Press announced today it was going to be available in September. So where's it going to come from between the 32,000 doses of Pfizer and the 120,000 people getting vaccinated every month? What am I missing?
Well, our estimates are around, the number of people who will want the vaccine, our estimate's probably about 379,000 people, and our estimate based on the supply of vaccine and what we've been led to believe will be accelerating increased level of supply, not including Johnson & Johnson, will be around 376,000 doses. There are some assumptions in that model, including, a 2% wastage, the fact that we think maybe 12% of people won't want the vaccine, and of course it's not approved for people under the age of 16 to 18 at this point in time. So if you take all those out of the population, including the number that have been vaccinated to date, the math puts us pretty close given the vaccine supply that we're anticipating.
Okay, so the base number is 380, and we presume 80 at the end of this month, so we've got 100,000 a month for the next 3 months. That presumes a remarkably accelerated rate of vaccines arriving. I hope you're right.
That's what we've been led to believe. That's our hope. That's our plan. That's what we're going to work towards, including increasing numbers of AstraZeneca into the mix. So. This is and changing the dosing schedule, right, is incredibly important because it allows us not to hold on to that second dose, which we had been doing in the past. As we said on Wednesday, that was a true game changer in how we could kind of manage the vaccine distribution and inoculation efforts moving forward. But these are the numbers that we're operating with, unless there's a disruption in supply chain. That we think that we can achieve that by the first dose by the end of June.
Thank you.
Our next questions are from Jason Piercy with Rogers Communications. Please go ahead.
Hi, I'm receiving questions from the public about patients who, anytime they're outside of self-isolation, are at a pretty great risk just because of any number of medical conditions that they have, but then who are also kind of forced to travel 3 times a week or more for dialysis. So in such extreme cases as this, can we adopt a process to approve special exemption when it comes to vaccination prioritization? Because these people are sort of damned if they do and damned if they don't.
So someone, I mean, I certainly don't want to make a broad sweeping statement there, but I mean, there are a significant number of these patients who have been identified as being part of phase 2 and the rollout in phase 2, so they will be getting the vaccine in the near future. You know, we've got a fairly extensive list of those people, and certainly people on dialysis would be in that group.
So anybody who's home worrying about it and stressing out about it, what do they go to a website? What call do they make? Do they expect to be reached out to? Like, I'm just trying to quell some of the anxiety that these people are suffering from.
So certainly those details will have to be worked out, and we're in the process of trying to work through those now. So, you know, we do ask for people's patience, but for people to know that they are, you know, they are on the list. So we will be getting to them.
Okay, thank you so much. I appreciate it.
Our next questions are from Andrew Robinson with the Telegram. Please go ahead.
For people who are receiving their first dose of the vaccine now, do they have a choice in what vaccine they can receive, or are they pretty much at this point they have to take what is offered to them at the time of their appointment?
So everybody has a choice if they want to receive a certain vaccine or not, and that's true for any vaccine. We hope that people will choose to take the vaccine that's offered to them. You know, certainly at this point, we know that we can't offer the vaccine, the AstraZeneca vaccine, to people over 65 and over. And so mRNA vaccines will be what's offered to them. You know, but all these vaccines are safe and effective and will reduce the risk of severe disease significantly. So we have to remember that these are all effective vaccines.
You may have answered what I was going to ask next with what you kind of said then. But I mean, what would you say to people who might be looking at these different effectiveness rates that are thrown around for various vaccines and saying, oh, I feel like I should want this one over another, say?
So I think, yeah, it's the same message. All these vaccines have been proven to be safe and effective. And, you know, we need to remember that the protection we're getting is better than the protection that you have without one. And we need to get as many people vaccinated as possible so that we can reduce the risk, hopefully reduce the risk of spread of this virus. So at this point, anyone, if you're offered a vaccine, you should take the vaccine.
Thank you.
Our next questions are from Michael Tutton with the Canadian Press. Please go ahead.
Could you just tell me the total number of AstraZeneca vaccine doses you have, when it begins again?
So the AstraZeneca won't be coming. I think next week is when we're expecting some doses. The doses have arrived in Canada, but they haven't been distributed to the provinces as of yet.
And can you just explain why you decided to go down the path of choosing first responders rather than Nova Scotia's path of first come, first served they're speaking of?
So we have a priority listing, and we feel that it is important. We developed that priority list of who we felt it was important to get the vaccine in the face of limited vaccine supply. And so that priority list stands regardless of what vaccine we have. So, you know, I think there are some groups that unfortunately we're not able to offer the AstraZeneca vaccine to, but, you know, for those that we can offer to, we would like to work through our priority groups and get those people vaccinated. We've said it's important for them to be vaccinated, and it's still important for them to be vaccinated.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. Knowing that many people are going to be able to get their first dose of vaccine on the Premier's comments by the end of June here, what does that mean for normal for us, for life for us, knowing that one dose doesn't necessarily cut down on transmission because we don't have enough evidence on it? But for those who are looking on the optimistic side and that, you know, it's a step closer to normal, but how much closer is it really for us?
So that's a really good question, the $1 million question, Kellyanne. And I wish I had an answer for you. But, I mean, what we know about vaccines, I mean, the very fact if we can have as many people who want to be protected, or 88% of our population protected against severe disease, well, that says, okay, even if this virus gets out there, you know, people aren't going to get severely ill with it. That protects our hospital capacity, our healthcare system capacity. It improves, you know, hopefully people becoming quite ill with it. So that's important. Even if it doesn't do anything with transmission, that's still really important, right? So we have to remember that. I hope that we'll have more data by the time June comes. I hope that we'll have more information and more evidence about how it affects transmission. You know, I think that's ongoing. That collection is happening. Certainly in some of in the country's bigger jurisdictions, they're seeing certainly some benefits to having, you know, congregate living settings vaccinated, and I think, you know, the expectation is that we will see a positive effect on transmission because that's generally how vaccines work and what they'll do. But you know, as I said before, until that evidence is there, we can't really say for sure that it is, right? Or that it will, I mean.
Thanks. And Minister Haggie, you noted in the briefing earlier this week that the system right now isn't even at 50% on capacity in terms of staff needed to vaccinate. Based on the information we're seeing here now and the amount of vaccine that's going to be coming to the province and available to those, are we beginning to reach out to other agencies to help us in administering this, looking to pharmacists like we did through our flu vaccine campaign?
Currently, we have been in discussions with both pharmacists and physicians, as far as I'm aware, through conversations with staff. Our estimates through the regional health authorities suggest that we would manage between 120 and 160,000 doses a month through public health alone without being overly challenged. So we have a first line, we have a second line, and we also have micro-credentialing if we found ourselves in the situation where we get the backlog of vaccine from February that we're expecting. We have factored that into our calculations. Pfizer and Moderna have said over Q2 that they would make this up. So that's where a lot of the dosage numbers that we've been using for planning come from. And I don't see capacity as a problem, and certainly we're perfectly prepared to discuss administration of vaccine with any group that has the skill set to do it if it's outside the pharmacists and physicians who we have lined up.
Thank you.
I'll now go back through each reporter to see if you have one final question. Peter Cowan with CBC, do you have a final question?
I do, yes. It was just a week ago that we were looking at the timetable of when people will start to become vaccinated with the 2 new vaccines online and the change to the single dose. When will people who are not part of the priority group, that phase 3, when will we start giving first vaccinations to them?
So certainly that depends on how quickly we can get through those phase 2 people and how quickly we get our vaccine and if those shipments stay on schedule as we expect them to. But you know, it'll be likely into May really before we can start thinking about that.
Richard Duggan with BOCM, do you have a final question?
Yes, we had a call to our newsroom from someone who says he falls under phase 2 for COVID-19 vaccinations, but tells us he was denied for receiving a vaccine at this time. Other than not actually being in an identified priority group, under what circumstances would someone be denied for getting a vaccine at this time?
So right now, we're working through our priority groups, and the priority group we've recognized that we had to focus on at this point are those over over 70. So that's who we will be focusing on at this point. So if somebody was not in that priority group, then I think they would be informed that while they might be in a phase 2 priority group, that's just not the priority group we're focusing on at this point. We know that the greatest risk for severe disease is increased age, and that's why we're focusing here.
Thank you.
Roger Bill with the Shoreline News. Do you have a final question?
Yes, Dr. Fitzgerald, I'd like to ask you to go back to the unplanned, the urgent Friday night briefing a couple of weeks ago when the Mount Pearl cluster kind of erupted. At that time, you said, this is the big one. This is the big one. I'm curious, thinking now that we're at one case, what would you have thought the odds would have been 3 weeks ago that we would have got to the point where there's only one new case in a day?
I don't know if I knew what to expect at that point, to be honest with you. We were dealing with a variant that we hadn't seen before. We were dealing with spread like we'd never seen before. And I think, we all believe that if we went hard and quick with those, with the lockdowns and restrictions, that we would see better control. But, this is hats off to staff at Eastern Health, who have done an amazing job at tracking down contacts and getting people to isolate, getting people tested, literally thousands and thousands of contacts. So, my hat's off to them, because we wouldn't be here if it wasn't for them. And that's the truth of it. And I think, that people have listened. And I think this certainly scared people. To see 100 cases in a day, I think was a scary point for people, and I think people really took it seriously. So I'm really happy and grateful for that, because all of that helped to get us to where we are. But, I don't know if any of us really knew what to expect or what to foresee at that point.
Jason Piercy with Rogers Communications. Do you have a final question?
Yes, I do, please. I'm wondering if there are other illnesses that typically we monitor the prevalence of that we're seeing a significant decline in since these measures have come into effect nearly a year ago, like perhaps influenza or maybe a few, let's call them more intimate infections. Like, are we seeing declines in other things that we typically keep an eye on?
We certainly have seen a decline in influenza over this year. I can't tell you the definite numbers, but I think we've only had one case.
Just one.
Yeah, I think we've only had one case this year, unless we've had more since then. But and that would be just one case that was tested. So there could be more out there than that. But so we've been seeing a decline in a lot of the respiratory diseases that we've had. That we normally would see over this period of time. But, these measures that we put in place that work for COVID also work for all of those respiratory diseases. With regard to sexually transmitted and bloodborne infections, we did see a decline in some of those in that group. But it's difficult to know if it's a true decline, or is it just because people weren't able or didn't decided not to get tested because of restrictions and things like that. So it's really can't read into the numbers too deeply, because we really need to dig into what the reasonings were behind that.
Jason, just anecdotally, and I think it's a good reminder to people at home, I have heard of increasing number of sliding accidents amongst kids. And so if your children are out there sliding, please ensure that they have safety equipment with them, including helmets. I know that people don't always think of helmets when it comes to sliding, but I know kids are out and enjoying the outdoors and being healthy, and that's great. But please ensure that your kids had the right safety equipment when they are outside having fun.
Well, at least the flu is down, so take that, anti-maskers.
Andrew Robinson with the Telegram. Do you have a final question?
Sure. Dr. Fitzgerald, we've I know we've heard anecdotally, at least, that the process of giving a COVID vaccination can be a bit more time-consuming than perhaps receiving the typical flu shot. I was wondering if you could just offer an idea of perhaps compare the process of flu vaccination versus COVID.
So they're both actually very similar. There is a slight difference to how the COVID vaccine has to be given in that it just has to do with how you draw or how you inject air into the vial before you pull it out. But so technically, there's a few small differerences there, but I don't think it's. I haven't done a lot of injections, just a couple at the very beginning. So I don't think that there's much of a difference with that. I think it's just the setup of the clinics, because of the measures we've had to put in place because of COVID, makes a difference to how we have to administer the vaccine, right? So we have to make sure there's physical distancing, there's appointment-based, whereas with influenza, traditionally, we would just, it would be drop-in and it wouldn't be appointment-based. So that part of it has perhaps slowed things down a little bit, and we can't get as many through in a clinic as we normally would have because of those restrictions. But the process of giving the vaccine, the nurses right now who are doing that are quite adept at it, and I don't think anything can slow them down, to be honest.
Thank you.
Michael Tutton with the Canadian Press. Do you have a final question?
Premier, or Mr. Furry, 1 year is approaching, and my question is the mental health of Newfoundlanders and Labradorians. Some people have described to me this as being like a public health disaster masquerading as a success for the whole region. Not my words of psychologists at several universities. What do you intend for going forward to help repair the mental health of your people?
Well, I think this is something that every jurisdiction around the world is trying to face head on. There's no question that mental health and addictions have suffered during a pandemic and a lockdown. And our government will be there. The people of Newfoundland and Labrador's government, I'm sure, will be there to support mental health and addictions moving forward. We recognize that this is hard times. There's anxiety-provoking times. It's stressful times. Being locked up, considering employment, looking after children, loved ones, being isolated. This all impacts people's mental health, and we appreciate that. We have provided resources online for people, but we know that that's not enough. We've always been committed to advancing mental health and addictions care within the province, and will continue to do so at an accelerated rate now as we emerge from this pandemic, to ensure that we have a healthy population physically and mentally.
Kellyanne Roberts with NTV. Do you have a final question?
Yes, thank you. Minister Haggie, you noted that by March 5th or end of day that all healthcare workers identified as priority 1 would have received their first dose of vaccine. I'm just wondering if that's still the case, if they will have received it by end of day today.
I would have to go back and verify that, but I've not heard that they haven't. Some of our reconciliation processes in the smaller communities are actually paper-based, which is one of the reasons there's always that lag between doses arriving and doses being delivered. But I can certainly go back and check, and I'll try and have an answer for you on Monday.
Thank you.
Thank you, everyone. Premier, do you have any final comments for today?
Thank you, everyone, for joining. Just a reminder again that if you are eligible for this round of vaccinations, please make sure you register. Also a reminder to please support your local businesses if you're able to. Many are offering online shopping, yoga, gym classes, as well as curbside or takeout delivery. So please support a local business when you can. Look after yourselves and each other, and stay safe.
Thank you, Premier. Stay safe, everyone, and enjoy the rest of your day.
This is Jan. Jan sometimes visits her neighbor Paul. Paul has COVID-19, but doesn't know it. Jan also takes the bus. So does Mo, who's a frontline worker. So if Paul infected Jan, Jan could infect Mo, who could infect a lot of people. But wait, they all have the COVID Alert app. So Paul tested positive and entered a code in his app which anonymously alerted Jan, so Jan stayed home and Mo went to work safely. Phew, close call. Help break the chain of infection. A message from the Government of Canada.